We keep hearing about an epidemic of obesity. Now, epidemic, of course, implies something to do with illness, and illness, well, ought to mean doctors. But there's a study out today that says very few doctors in Canada are actually telling overweight patients that they need to slim down. We'll check on that with CBC's medical specialist, Dr. Karl Kabasele. Okay, so you walk into the doctor's office. Why aren't more of them saying to their patients who are obese, you gotta lose some weight, because here's why.
It's a classical missed opportunity. Absolutely correct. There are a number of problems, and a lot of it has to do with perception. So a lot of physicians still don't quite think of obesity as a disease per se, but more as a risk factor for other diseases. And I think in our society as a whole, we tend to think about weight loss and obesity as something that's a personal responsibility. And that's not really fair, because there are so many factors that make it a health or a medical issue. And it's not just a simple matter of always deciding that you're going to lose weight.
Funny thing is, I don't think it's ever anything personal in a doctor's office. Once you've had a pap smear, there's nothing personal left.
Okay.
But how do you approach patients, for example, when they come in, they've got a weight issue, and you say, you're too fat?
Well, I think part of sort of normalizing the medical aspect of obesity and weight is to just address it and be straightforward about it. So, I mean, obviously you want a sort of a soft opening. You want to talk about, you know, do you have any concerns about your weight? You might also want to make sure that the patient understands the link between being overweight or obese and, you know, some common health problems like high blood pressure, heart disease, arthritis. There's so many things, so many ways that your weight can impact your health.
Tell me more about what this study actually found then, too, Karl.
Well, what they were really interested in was whether doctors, frontline, you know, primary care doctors, were following recommendations that came out in 2006 around obesity and addressing obesity. There were 72 recommendations. Of course, this one survey couldn't cover them all. So they looked at three things. They looked at whether doctors were measuring waist circumference, which is a good measure of obesity, just taking the tape measure, running it around the midsection. Easy to do in the office. The other thing was, are doctors screening for diseases associated with obesity, like diabetes and high blood pressure? So very easy to test someone's blood pressure right in the office. And then, you know, diabetes is a little more tricky. You got to send them for a blood test. But again, nothing that complicated. And the problem was that they found that only 14% of those people they surveyed, these are patients they talked to, actually had their waist circumference measured. So it hasn't become something that's standard.
Yeah, I've never had mine measured.
Yeah, well, now the good news is that most doctors will check your blood pressure and check for diabetes. And it's interesting that as a patient gets larger, so the larger the patient, the more overweight, the more likely they are to have those interventions. But we still need to do a better job of screening everybody, talking to everybody about how weight influences their health.
So how should doctors then be trying to manage their patients' weight?
Well, obesity, if we can agree that it is a medical condition, just like any other medical condition, there should be sort of a, first of all, establishing the patient's status. So you put them on the scale, you check their height, and then you calculate their BMI, right? And that tells you whether what category they're in terms of obesity. Once you've done that, you look for underlying medical causes of why they might be overweight. You look at their sort of social milieu and see what factors socially and psychologically are contributing. And once you do that, you can address the medical aspects and you know, do your patient education, make sure they understand physical activity, diet, etc. Send them to a dietitian if necessary. But the one thing that this study found that doctors aren't doing is introducing the idea of surgery, because that is an emerging area for people who are obese. There are a number of surgical procedures that have been shown to be effective in helping people to lose the weight and also to prevent some of those complications like diabetes down the road.
All right, thank you, Karl. Always great to have you on. Dr. Karl Kabasele, he is CBC's medical specialist.